Hello, good morning. I'm really happy to be there to present you a really small pieces of the mood puzzle. It's a tool named ArbocartoR that we developed. It's a simulation tool for decision support in the implementation of surveillance and control of mosquito-borne diseases. Just to have a little bit of context, as you know, since the last decades, the tiger mosquito, also known as Aedes albopictus, has done a really great job at colonizing the south, and we saw it yesterday in the presentation, south and eastern part of Europe. And over the past 3 years, there was an increase in the number and size of the outbreak, not a big outbreak like in tropical areas, but it's starting to be really a real concern. So we wanted to provide support to the public health operators to optimize the surveillance, to have an early detection of potential epidemics and provide decision support in the event of those outbreaks to better target for vector control. So the objective was to, like we do in Mood, to co-create a tool with the user, is here identified as the person in charge of designing the vector surveillance and control. So to co-create a tool to identify the higher risk area, as Lucas said, in space, but also in time, when and where there is a higher risk of introduction, but also if there is an introduction, what is the risk of what is the size of the risk of the outbreak, and where could it spread more probably. So mechanistic modeling for mosquitoes is really a good tool. Mechanistic modeling, unlike statistical modeling, is trying to describe the biological processes, our knowledge as a biologist and entomologist, into equation. Here I'm not going to show you equations, but I need to explain you the model a little bit before presenting the tool. So we simplified the system with the three main components of vector-borne diseases: the vectors, pathogen, and the host. And we try to identify the highest risk related to the vector. So we used something that is a model that is well known by the modelers in mechanistic model for mosquito. It's the ArbocartoR model, which was developed by Anne Listran and her team in CIRAD in 2013. This model is really great here because it split the mosquito population, the mosquito life cycle into the different stages. So using these precisions enable us to act directly on eggs or on larvae, like increasing the mortality to try to have scenarios of vector control. So we use this description of the mosquito life cycle to simulate the abundance of the mosquito over time and space. Then what we did in Mood is to combine this mosquito population dynamic model with an epidemiological model. So here we consider the epidemiological states of the mosquito, susceptible, exposed, and infected. And for the human, we consider 4 stages: the susceptible, exposed, infected, and recovered. So the probability of having a secondary cases is made of the amount of mosquito, the epidemiological state of the mosquito population, the human population, and also the temperature, because we know that the incubation period is dependent of the temperature. So here, this part will be stochastic in the model. So it will be highly random because there is randomness with the number of infection. And upon request of the user, they were really interested, especially in France, in the southern of France, where the mosquito population favorable period is related to the touristic period. They were really interested into knowing how the disease could spread based on the human mobility. So we wanted to include this in the model, and we based our work on Soriano Spano's work, and we split the population, the human population, into 2 subpopulations: the resident and the visitors. And the visitors are moving from one place to another. And by being bitten by mosquitoes, they are in this way spreading the disease. So this is the diagram of the model, just a simple simplified representation, but where you can see how in one place we split the population of mosquitoes. Here you see the aquatic stages in blue, and in green it's the susceptible stages of adult mosquitoes with a different behavior, or thinking that's where they are going to bite a human, then resting, then ovipositing, and you have nulliparous and parus. In red, you have the infected mosquitoes, and on the top, we didn't take the gender. We have really just simple representation of humans. It's susceptible, exposed, and yes, I know. Susceptible, exposed, infected, and recovered. So, as I said at the beginning, the objective was to raise, to improve the responsiveness and the reactivity to provide tools that could be used on the field. So, actually, we developed ArbocartoR into an R package that will be easy to use by the modeling community, the scientific community. But we also developed a web interface, which is really just like an extension with this epidemiological part of the well-known ArbocartoR tool, which is on the left there, which is a tool that has been co-constructed with a series of training workshops with the users, and it has evolved with the need of the user, the request, and we try to do the same with ArbocartoR, with one first training in February 2023. Elena mentioned it yesterday, with the users to know what was requested, what was needed, and where we need to focus. So the next part, the second part of my presentation is really print screen. So I really ask you to trust me when I say it's user-friendly and dynamics and everything interactive, but also I will encourage you to try it later. So here it's to show you, in the tool, you will have data provided just for training the example to test, but the user has to know his land, his area of expertise. So here is you need to provide the division of the space, and for each division you need to know how many people you have, what is the carrying capacity, so the number of the maximum number of mosquitoes that the area can contain, and you need to have meteorological data, which are the daily temperature and rainfall. You can get that from climate models quite easily now. So all those data that you will include into the model as tables, not really comprehensible, you will be able to visualize really easily. You can change the layer, click on the map, zoom in, zoom out, have details on each parcel and each areas. Then you need to initialize the simulation. You choose the vectors. So for now, we only have parameterized the model for Aedes albopictus and Aedes aegypti in tropical and temperate environment. You need to select a pathogen. And you can, if you want, implement, design a vector control protocol by adding vector control measures. So here, breeding site, reduction, larviciding, and adulticide. And you need to design them in space and time, and it will be implemented into the simulation. And you can also define the scenario of introduction, so where and when you will have people introduced in your population, exposed people introduced in your population. So you run the simulation and you will have some key results that will define us and with the training. So you have, for example, key numbers, like the number of population with outbreak after introduction, the number of autochthonous infections, the number of areas that were reached by the infection after one introduction. You will have map with the basic reproduction numbers, the vector density. We provided the epidemiological curve for each simulation, and of course, the demography of the population of the different stage, all the boxes that you saw on the diagram with the epidemiological stage and demographic stage. So the tool is well advanced now, but it still has to evolve and continue, partly in improving the ergonomy by facilitating the use, by doing training, workshop exchanges with the end users, but also by adding some other vector control activities, some co-circulation of different strains, many different things that we can do in research, for example, including gender into the human population, so many things. But this tool is today highly performance, I think, to have the relative risk in space and time. Not the perfect amount of mosquito, of course, but the relative risk. So where to focus, where to target the force, the surveillance. The tool is quite generic and flexible. It has been adapted. The model has been adapted to many other species, Anopheles, etc. But it's not in because it's called ArbocartoR. But there are papers on this. The main limitation is the calibration, of course, knowing the carrying capacity. It's always a problem with mosquitoes modeling. But I think one of the key messages that this approach was a really great bridge in between the research world, the modelers, our community, and the end users, with those open source codes that are directly feeding into those two interfaces, so the Java-based software and the R-Shiny interface, and those regular training sessions that help to improve our knowledge and to have the same language between us. So I want to thank you for your attention. Here you can access the app. You can also just look on Google for ArbocartoR and you will go to it, and you can contact us. As for the platform, yesterday Guy Hendrik said, every comment is great, positive or negative, at least if it's constructive. I didn't put any equation, but you have them in the papers. They are here, but they are also on ArbocartoR website. So you can see, Janos Panos for the mobility. The epidemiological model is not published yet, but this is all for the R0 calculation, for the mosquito population dynamics model, etc. Thank you.